Hi, my name is Carlos St. Jess, a licensed acupuncturist, holistic healthcare provider, and I just wanted to speak briefly on a condition known as kyphosis or hyperkyphosis. As you can see here, I brought a prop with me, and it is something that I see common in the clinic amongst older adults. I want to say amongst adults in general, right? The reason I say that is because literature will say that it's more common in teens, young adults. It's something that affects all ages, so I just wanted to give you a little overview. And so kyphosis, so you look at your spine here. We have a normal spine, as you can see, and it already has natural curves in it. What kyphosis is, also known as round back or hunchback, as you may have heard the term. What it does is it's a curvature. It's extended curvature of the upper back. So this is the thoracic portion of your back, the upper thoracic. And what happens is, as you can see here, when there's a bigger curve, when the curve is hyperextended, right, it changes. It changes how the upper portion of your neck and your back protrudes. Right? So it changes your posture. So that's where you get the rounding of the back. If that makes sense. Why does it happen? A couple different reasons. What I'm covering today is known as postural kyphosis, which is due to either or age-related kyphosis, right? Which is due to age, which is due to posture, the way you sit, the way you conduct yourself throughout the day, can have an effect over time on your spine. Just keep in mind that, right, these are just bones, right? What keeps the spine upright, aligned, include the muscles as well. So for the treatment of postural kyphosis, also known as hyperkyphosis, because you already have a natural curve, which is known as kyphosis, but clinically we just call it. Anyways, there's a lot of jargon. There's a reason why we say kyphosis in place of hyperkyphosis, but you don't need to worry about that right now. So, with that, so for treatment, recommendation is you can do physical therapy, you can do muscle manipulation, you can do chiropractic care, acupuncture can help, acupressure, lots of different modalities. There is not a need for surgery technically, right? Unless it's very severe and needed, right? So this is something you don't need to go into the night for. With that, I think it is important. It is something that I do see, and it's not something that people will come in for. Someone hasn't came in and said, "Hey, I have kyphosis in my back," right? Or my back is hunching, whatever the case may be. It's something that even they may notice, but it's not a main complaint. It's something that I find upon the physical examination. And then I'll point it out and I'll let patients know. And whether or not this kyphosis is affecting anything else, literature says that it may affect your lungs, right, from the overextension, but not necessarily affect other systems, right? Whether it affects it's affecting the pain, or you've had pain in the back due to trauma, right? I have found that helping the body obtain its natural posture, trying to reverse some of the kyphosis, can help in the overall recovery, can help in the overall pain management, right? Can help you just in your overall health. So as an acupuncturist, I enjoy looking at all aspects, anatomy and physiology, the biology, traditional Chinese medicine, 5 elemental theory, and we put it all together and see how we can help patients, such as yourself. This is Carlos St. Just. You feel free to come visit me here. I'm in Burbank, lovely Burbank, and South Pasadena. home studios and all that other fun stuff. More than welcome to shoot me a message if you have any questions. Besides that, I'm very glad to be here, and you have a wonderful day.